Hey, what's up guys? This is Tyler, pharmacist with Pharmacy Update.
I like turtles.
Today I want to talk about a drug that I dispense quite a bit of, and that is Cyclobenzaprine, or brand name Flexeril. The topics that I will cover today include the uses for cyclobenzaprine, some of the side effects that you could possibly experience if you take this medication, including a very common one that you will want to know about, some drug interactions that concern cyclobenzaprine. This is a common medication that I see out of urgent care, so that might be something you'll want to know. And at the end of the video, I will discuss some counseling tips that you may want to know before you take cyclobenzaprine. So stick around for that. Before I get started, I just want to say that the information in this video should only be used for informational purposes only and should not be taken as medical advice. Please consult with your doctor before making any medication changes. And if you feel like the information in this video is helpful, please leave a like. And if you want to see more videos like this, hit that subscribe button. I would greatly appreciate it. Alright, with all that being said, let's start with the uses of cyclobenzaprine. This will be a pretty short topic. I would say the grand majority of people taking cyclobenzaprine use it for this first indication, and that is skeletal muscle spasm. So this medication is pretty effective at relieving muscle strains and pains. And like I said, it is a very popular medication, so it must work pretty well for patients. Typically, when you start taking cyclobenzaprine, you may want to start at a dose of 5 milligrams 3 times a day. But if you have some success with that, you can increase the dose to 10 milligrams 3 times a day. Now, I do see many prescribers that go straight for that 10 milligrams 3 times a day. And in some cases that may be warranted, but I would say, most times you'll want to start out with a 5 milligram 3 times a day. Normally you will only want to take cyclobenzaprine for a max of 2 to 3 weeks. Once your particular problem gets better, you will want to discontinue this medication if possible. However, I do see quite a few patients that are taking cyclobenzaprine on a more chronic basis. These patients may have chronic muscle spasms or something along that line. Another use for Flexeril or cyclobenzaprine is fibromyalgia. Now, this is an off-label use, so this is not approved by the FDA, but some doctors have tried it and found that it does help these patients. Usually you'll want to start out with a dose of 10 milligrams once nightly at bedtime if you are using it for fibromyalgia, and you can increase this to 30 milligrams at bedtime. Studies have shown that taking this only at bedtime worked just as well as taking it 3 times a day, and also resulted in less side effects. So if you do take this medication for fibromyalgia, I would just take the entire dose at bedtime. Next topic I'm going to cover here is the side effects of cyclobenzaprine or Flexeril. Probably the most common side effect is drowsiness. This does affect up to 39% of patients, and this is the one you will want to know about. So this is not something you'll want to take before you're going to work or to school. Anything really that requires mental alertness, driving, anything like that, you will want to avoid. Now, if you start taking this medication and you start to find out how it affects you, you can then decide for yourself if you're able to do these things. Kind of going along with that is the side effect of dizziness. This can affect up to 11% of people that take cyclobenzaprine. Another very common side effect is dry mouth. This one isn't as well known. And if you do develop this, there are some mouthwashes and other products that you can take to help you. But this does affect up to 1/3 of people that take this medication. So it's something you'll definitely want to watch out for. Another one here is fatigue. And I should say that I didn't list all possible side effects, just some of the more common ones. And lastly, we have constipation and indigestion, which can happen in a very small percentage of people who take this medication. On to the next topic here, possible drug interactions that you will want to watch out for. The first medication class here is opioids or pain medications. Some examples in this class include morphine, oxycodone, and tramadol. You need to be careful when taking these medications together because they both depress the central nervous system. So you can become very drowsy when taking these both together. What you will want to do if you're taking both of these together is monitor yourself for increased sedation and, more importantly, respiratory depression. Make sure that you are breathing okay. Because of all these issues, you will want to take the lowest effective dose for both of these medications and try not to take them very long if possible. Next group here is certain antidepressants, and these can be taken together with cyclobenzaprine. You'll just want to use some caution. Medications in this class include fluoxetine, citalopram, and also some others. The problem with this combination is that it can possibly increase the risk of serotonin syndrome and QT prolongation. Now, serotonin syndrome is very, very rare. You hardly ever see it, but this is a serious situation. I won't get into it too much, but it's basically too much nerve cell activity in your body. And you can look into this more if you wish to do so, but ain't nobody got time for that.
Ain't nobody got time for that. Ain't nobody got time for that. Ain't nobody got time. Ain't nobody got time. Ain't nobody got time for that.
Also, taking these medications together may increase the risk of QT prolongation. QT prolongation is basically when it takes your heart longer to recharge in between beats, so just watch out for that. And the final one I listed here is tobacco or smoking. When you smoke, it can affect the metabolism of cyclobenzaprine. It can increase that metabolism. So basically what it can do is make cyclobenzaprine not work as well. So if you smoke and feel like this medication is not helping, this could possibly be your issue. And that brings me to my final topic of the day. These are some counseling tips to help you when taking cyclobenzaprine. I've already covered most of these, so it's kind of a summary. First one is take cyclobenzaprine at bedtime. Like I discussed, this medication will very likely make you drowsy. So to get the best experience, I would try to do this. Use caution in older adults. This medication is on the Beers list, if you know what that is. Older adults can be more prone to having excessive drowsiness when they take this medication. And what you really worry about with the elderly population is falls. For younger adults, falling may not seem like a big deal, but with these patients, a fall can be a devastating event. It can lead to broken bones, concussions, etc. So just really be careful if you're an elderly patient taking cyclobenzaprine. As we already discussed, cyclobenzaprine should be taken for the shortest duration possible. It really should not be used on a long-term basis. If you do end up taking it for multiple days, try to take it at the same time each day. This allows for a more consistent level of medication to build up, so it will give you better results. And finally, just monitor yourself for any arrhythmias or tachycardia. If you do have these feelings while taking this medication, contact your doctor immediately. Like we mentioned, this medication can possibly increase your risk of QT prolongation. Well, that's all I have for today, guys. I hope you enjoyed the video. If you want to see more videos like this, go ahead and subscribe to the channel. And if you have any questions or concerns that I did not cover, please feel free to leave it in the comments below, and I will try my best to get back with you. Also, if you've taken this medication before, tell us about your experience. I always love reading those. So thank you guys again, and I hope you have a nice day.